We have 3,799 cases of coronavirus in Victoria. That's an increase of 273 on our last update. I'm very pleased to be able to say that there were 30,195 tests done yesterday. That's another massive testing effort, and let me take this opportunity yet again to thank each and every one of those Victorians who came forward for a test. It is critically important. Arguably there is nothing more important than coming forward if you've got even mild symptoms, so that we can get your test results, we can work out where the virus is, take those necessary steps to quarantine you, to isolate your close contacts and make sure that those who are positive or have a very strong likelihood of being positive are not moving through the community, not circulating, not spreading this virus. I am sad to have to report that another gentleman has passed away, a man in his 70s. I can't provide you any further information about the specifics of that particular individual, but of course we send our best wishes and assure that family that our thoughts and prayers are with them. This will be a very, very difficult time for them. The total rate of testing, we are now 1,125,414 tests since January 1. There are 57 Victorians in hospital, 16 of those in intensive care, 1,484 active cases, and the total rate of testing is something I do want to focus on today. That is a really significant effort, and I'm so very pleased that so many people are coming forward. I'm very grateful that so many people are coming forward to get tested. That does give us the information that we need. Now, before I move on to talk about schools and what the next 6 weeks is going to look like, I just wanted to make some general comments. Driving in this morning from the sort of middle ring, the middle southeastern suburbs, it's very noticeable that there's a lot less traffic. We've all seen lots of footage, lots of reports about very few people moving around, retail centres, very few people moving around, the city. I want to thank every single Victorian for taking these rules seriously, for taking the circumstances that we face seriously. This is a dangerous time. This is a very challenging time. And I know we're asking a lot of Victorians, but we simply have no choice but to acknowledge the reality we face and to do what must be done, and that is to follow those rules, to only go out when you need to and only go out for the purposes that are lawful. It's not an opportunity to go shopping each and every day for things that you don't need. It's about just using common sense. Common sense, and that's what will get us through. I want to thank every single one of those Victorians, so many people, the vast majority in fact, that are doing the right thing. There are still some who aren't, and I just have a very clear message for them. Victoria Police issued many more warnings than fines last time. They've been very clear, the Chief Commissioner's been very clear that will not be the case this time, that if you're out and about doing the wrong thing, then Victoria Police will have no alternative but to issue you with a fine. I don't want that to happen. I want people to do the right thing, to play their part. We all benefit, our community, our whole state, individual families and individuals benefit from this strategy working, but it will only work if everyone plays their part, not through good luck, not because we just sort of kind of get to the point where we think that, well, it doesn't matter for me, other people are doing the right thing so I don't have to. We've all got to play a part in order to deliver an effective strategy, and that's one where numbers stabilise, they get driven down to very, very low levels, and then we can look at our options beyond then. Now, there's a lot said about frontline workers. There's a lot said about nurses, doctors, paramedics, all sorts of people who are often termed frontline workers. I just want to make it really clear, they're not the front line. They are our last line of defence in our fight against this virus. The people who are truly on the front line are individuals and families right across metropolitan Melbourne and Mitchell Shire, and indeed right across our state. If every one of those front line do the right thing, then we will get past this. The opposite is true, of course, that if we don't follow the rules, if we don't play our part, then we will simply see this virus continue to spread, and it will be a longer second wave, a more pronounced, a more tragic second wave than it ought be. So again, this is not an ordinary Sunday. These next 6 weeks are not an ordinary winter. We all have to play our part. We cannot ignore the circumstances we face. Nobody wanted to be in this position, but this is where we find ourselves. I am deeply, deeply grateful to every Victorian who is doing the right thing. I thank you. But to those who aren't, there is a very clear message. You need to do the right thing, otherwise you face being caught by Victoria Police and a fine. And if that's not enough of a motivation for you, just think about the fact that every family, every community, every person across Melbourne and across Victoria has a stake in this. We will all benefit from this strategy working, and we will all pay a very big price if it doesn't. So again, thanks to those who are doing the right thing. It is so important, and you can see it in the mobility data, you can see it in large public spaces, retail, all that, the list of things I went through a moment ago. You can see it also in the number of people that are wearing masks. I really do thank every single Victorian who's out there playing their part. That's the only way that we will defeat this thing. Now, in terms of schools, just to repeat where we got to the other day, so the announcements we made the other day. From tomorrow, Year 11 and 12 students in metropolitan Melbourne and Mitchell Shire will return to face-to-face learning. Year 10 students who are undertaking VCAL and VCE subjects, for those subjects, they will be back at school for face-to-face learning as well. Specialist schools, they will return to face-to-face learning also, and that comes from direct feedback from parents and from teachers and from those school communities about just how challenging at-home learning is for those kids and those families. In terms of the rest of our school kids in metropolitan Melbourne and Mitchell Shire, I stress there's no change to arrangements across regional Victoria. That will be normal start of schooling. In terms of other students from prep to year 10, they will from July 20, noting that we've extended school holidays by a week, pupil-free days this week, but from July 20, prep to year 10 will go back to remote and flexible learning. Now, the first thing I want to say is I know this will be very, very challenging for many, many parents. There is simply no alternative but to go to this footing. We can't have the best part of 700,000 students as well as parents moving to and from school, moving around the community as if there wasn't a stay-at-home order, as if there wasn't a lockdown. That'll put at direct risk us achieving our aim, and that of course is to drive these numbers down at the end of the 6-week period and get to a position where we have control and where we can begin a very cautious program of easing. This will be significantly challenging, particularly for parents of smaller kids, and I thank them in advance. They've done it once before. I have a very clear appreciation of how challenging that is, but it is the only way to go forward. If we simply allow all of our kids to move around, if we have parents doing drop-offs and pick-ups, if we pretend that this isn't real, then that will put at risk this strategy. It'll put at risk the transmission of the virus, and it won't so much drive numbers down, it'll directly contribute to more and more people becoming infected, and an even bigger challenge than the one that we face now. James is going to speak about support that has been provided, IT support, whether that be Wi-Fi connections, devices, all of those things. I'll leave that to him to do in a moment. But there are two important differences this time versus last time, and they come from listening to parents and putting in place the very best arrangements we possibly can. Firstly, for any student that has special needs but attends a mainstream school, school will be available for you to go to school and do the online learning from school. The curriculum, the program, the learning, the teaching and learning will be exactly the same as if you were at home, but you will be able to go to school and be able to be under the supervision of staff. That is in recognition of just how challenging it can be for kids that have got special needs to get everything that they need at home. That's a direct result of feedback from parents. Now, I hasten to add, it need not be every day of the week. It might be a kind of respite arrangement that parents might put in place. Of course, if those students and their families choose to be at school for the whole week, then that is an option that is available to them. Similarly, this is not different, but I want to re-emphasise it. It is the same as last time, but I just want to re-emphasise it. If parents have to work, and that's not a reflection of the job that they do, we've all had to, I think, re-evaluate what we might regard as a key worker. So whether mum and dad are stacking shelves at a supermarket, or whether mum and dad are a police officer or a nurse, whatever the profession might be, if you can't work from home, your kids can come to school as well, and they can receive that same remote and flexible learning, but they'll do it in a classroom setting. So whether it be kids with special needs or the children of people who cannot work from home, and we still encourage people to work from home wherever possible, school will be open for them to be part of that remote learning environment, but from a school setting. I do appreciate just how challenging this will be, again, particularly for parents of very small children, but the alternative is to have hundreds and hundreds of thousands of students as well as their parents moving around metropolitan Melbourne. That will not only put our strategy at risk in terms of failing to suppress this virus, to drive it down to very low numbers, it would almost certainly contribute to the spread of this virus, the exact opposite of the strategy, the exact opposite of the outcome we all want. I know it won't be easy, but it is exactly what we must do. It all comes off the back of the best of medical advice. It's not a decision that we take easily. It is going to be very challenging, but it's what must be done given the circumstances that we face and given the fact that we just don't have the luxury of pretending that this is not real. I might now throw to James just to go through the logistics, but I can confirm that from July 20, prep to year 10, and at least until August 19, at least for the 6-week period, the remote and flexible learning, the at-home learning, will be the way the term starts. Beyond that, there are those special arrangements for the kids of people who can't work from home, and indeed those students who have special needs but attend mainstream schools. That's from feedback from parents. We think that's a fair and reasonable thing to do. It may not be for the whole week, but I think it will be a comfort to those families and much better for those students. It won't be easy. We know and understand that, but it is a critical part of our fight against this virus. If we all just go about our business as if this was a normal term 3, then far from driving case numbers down, we will in fact drive them up, and that's in no one's interests. To talk about some of the practicalities of this and some of the additional support that we're providing, I'll now throw to the Deputy Premier.
Thanks very much, Premier. So as the Premier has just said, this is an incredibly challenging time for everyone in education, from parents and students learning from home to our teachers and our staff. It's challenging, but it is absolutely necessary. Last time, our teachers and staff did a brilliant job. They will do a brilliant job again. So my message to parents and to students, trust your teachers, trust your schools. They will do a great job again. We've learned a few lessons, as the Premier said, from the last time of flexible and remote learning. So we will have VCE and VCAT students at school, face-to-face teaching. We will have all our special schools open from tomorrow, and from the 20th of July, all students with a disability, and that includes students who may not be receiving funding under the PSD funding program. So all students with a disability have the ability for their kids to be learning on site at school. In terms of the supports that we will have in place, we've already rolled out through the course of Term 2 48,000 devices and laptops and around 26,000 dongles. We've got further devices and dongles in stock, so over 1,000 devices and over 2,500 dongles. So if we need to provide further support for students during this period of flexible and remote learning, we'll be able to do so. In terms of early childhood education, under the advice of Professor Sutton and his team, early childhood education remains open as it was through the course of Term 2, but we acknowledge that this is a tough time for parents. So to support parents in terms of those really important early years, we're providing full support, free kinder for eligible sessional kindergarten, free kinder through the course of term 3. So that is around $460 per child. And for parents of children who attend early childhood education outside of Melbourne Metro or Mitchell Shire, we're providing half the cost of the parent subsidy, so that's about $230. So providing that extra support to ensure that we support children going to early childhood education, as well as supporting the viability of these critical settings. In terms of other supports and a focus as we return to flexible and remote learning, we've taken a lot of lessons learnt out of the first period of flexible and remote learning, and that directly went, as the Premier said, to the settings that we have in place for special schools, for students with a disability, and for our VCE and VCAT students. But we also know that this is going to be a really challenging time for everyone, particularly in terms of mental health. We've got all our existing resources in place: mental health practitioners, our GPs in secondary schools, our student support service workers, our school nurses. All of those will be utilised to support both directly for students at school and also remotely support for students' mental health. We've got the partnership with Headspace for counselling. We've also got some new partnerships with Melbourne Football Club, for example, with the Smiling Minds organisation, about providing resources and tips for students to keep them engaged, to support their mental health through this period of flexible and remote learning, which will go to at least the 19th of August. So we've done it before and we did it well. We can do it again and we will. My gratitude, my respect, my thanks to our teaching workforce, to all our staff, principals and support staff in our schools. I know this is a challenging message for you as well, but you did a brilliant job last time. You will do a brilliant job again. So my thanks, but this is absolutely necessary to ensure that we reduce the numbers that we're seeing at the moment. These settings, learning the lessons from the past, but keeping more than 700,000 students and their parents and carers not moving around metropolitan Melbourne or the Mitchell Shire, will go a long way to the goal that we all have.
Better take any questions you have. Or if you want to ask Professor Sutton to go through outbreaks and things, and then we'll do it that way.
Thanks, Premier. Certainly there are a lot of outbreaks that we're currently managing. The numbers are changing all of the time with 200, 300 cases per day. So I'll speak to some of the most significant outbreaks at the moment. There are at least 145 cases linked to North Melbourne and Flemington public housing towers. The new number of cases has decreased in recent days. I should say it's been a very challenging operation, but having spoken to community members in the last couple of days, and I'm seeing them again today, they are the glue that has actually held this operation together. There have been really committed responses by multiple agencies, but the communities in these towers have the wisdom and intelligence, and they know the needs of their own community members, their families, their extended networks, and they've been really critical in identifying the needs more broadly across those towers, and have been instrumental in making this work. They want the same outcome as we all want, to be protected from coronavirus and to have their loved ones protected.
On that number, it was 158 on Thursday. Has it gone down because of duplication? Or?
No, look, there are different linkages at the moment through our database system. 145 cases are currently linked, but I think the true number is greater. But we'll come out with numbers this afternoon. As I said, there are at least 145 cases. 22 cases are linked to public housing in Carlton. Again, these are challenging settings for the structural issues that are at play there and the fact that they are in hotspot areas in terms of transmission. But again, they're being supported in much the same way in terms of having the hand hygiene, the cleaning, the testing, and then the support to isolation and quarantine as is required. And I think they will also get under control over time. Again, the communities within Carlton, within wherever it is, Fitzroy, Dandenong, elsewhere, want the outcomes, and we know what's required. It is identifying people who might be unwell and supporting them in their isolation and the quarantine of their close contacts. There are 4 cases linked to La Manor Supermarket in Essendon, 2 cases linked to Linfox Distribution Centre in Truganina, 11 to Somerville Meats, 6 to Senvic Construction Riverina Apartments in Footscray, 4 cases linked to JBS Abattoir, 2 linked to Box Hill Hospital, 11 linked to Brunswick Private Hospital, 11 to Menorock Life Aged Care Facility, 12 to Glendale Aged Care Facility, and 8 linked to Alfred Hospital. Again, these numbers will change through the course of today. We'll have more detailed figures in the Chief Health Officer media update this afternoon. But as you can see, there are some high-risk settings there. We've always understood them to be high risk. The abattoirs that have been affected have gone through a shutdown. The entire workforce is effectively in quarantine, very broad testing being done, and those numbers will be controlled by virtue of that. But aged care facilities, healthcare settings are at-risk settings because of the nature of close engagement required for the care in those settings. They will be an ongoing challenge. We are responding immediately to notification in those settings.
In particular for those hospitals, what's your advice to the public who may just have to go there for their own care?
I think they should. People absolutely need to access the care that's required. They should wear a mask. That is doing the healthcare workers a good service in terms of protecting everyone. They should absolutely notify the triage nurse at arrival with a mask on if they've got any symptoms that are respiratory symptoms or symptoms that might be coronavirus symptoms, because they will be isolated accordingly. But as a visitor, you must not visit if you're unwell. You should not visit, and you're not allowed to visit if you're unwell.
High cyclone fencing was put up around the Elford Street Tower last night. I assume that people were supposed to be exercising. It's since been taken down only after some of the lawyers got involved. Did you think that fencing was suitable? Was it necessary, and why was it put up to begin with?
I'm not specifically engaged in that operation. I imagine it was just to allow an exercise area that was manageable in the same way that our hotel quarantine also have cordoned off areas for people to exercise, but I don't know the specifics of the response.
About those cases in Carlton, how come that wasn't included in the shutdown of the 9 towers? I don't know, are they in towers in Carlton, or are they in different public?
Yeah, they are in towers. They're not as high risk as the towers in North Melbourne and Flemington, but all towers really where there's a concentration of people are at-risk settings. But we have identified those cases earlier. We have gone in with the same kind of public health response, and I think that will be sufficient to mitigate the risk there.
When were those cases first discovered?
I don't know when the first cases were notified, but there have been cases over the last week or more that we've been watching.
Are you concerned about the number of cases coming up in our health departments at hospitals across the city?
Yeah, of course it's a concern. You know, as the last line of defence, we know that they're a critical workforce. They have the personal protective equipment available to them, but it's a high-risk setting in managing all of the cases that we know need to be cared for in healthcare settings. The workforces know what to do, but it is a risk that can't be mitigated down to zero. You know, my thoughts go to those frontline workers. I've been an emergency department doctor for years, and they are brave, and they are brilliant in responding to the challenges of positive cases that need to be managed there.
Do we know which departments those 8 cases are linked to? No, the Alpha is obviously the trauma centre for Victoria. Does that change where trauma is directed in the state?
No, I don't think so. Alfred will remain a tertiary centre for trauma management. It's the COVID ward at the Alfred is obviously a higher risk ward. They'll be looking at managing the risk there. But you know, through all of this, every incident, every outcome that involves healthcare workers getting infected, you know, would go through a root cause analysis and a reflection on how it might have occurred and what might be tightened up.
Are you
especially with the
concerned that 5 of 8 of them have been classified as community transmission? Does that imply that perhaps there's community transmission going on in the hospital or near to it?
I don't know what the specifics of that classification is, but healthcare workers can obviously get it from patients, but they can also get it from other healthcare workers. Sometimes that's in a home setting, sometimes that's in a social setting within the workplace. Obviously, all of those elements need to be managed. That's what the Homes for Heroes program is meant to support. And certainly there's communication that reinforces healthcare workers' need not just to protect themselves with personal protective equipment when seeing patients, but also engaging with other healthcare workers so that everyone's protected.
Especially with the recommendation on face masks now, do we have absolutely enough PPE for hospitals and medical centres everywhere?
Yeah, we do. We've got tens of millions of surgical masks and further millions of N95 masks to protect healthcare workers. There are more on the way. There's a pipeline that's continually being reviewed in terms of what the requirements are, but there is no lack of PPE for our healthcare workers.
On those towers.
Tracing team going at the moment?
They are working hard. They are doing a brilliant job. The task of chasing up 200 plus new cases every day is relentless. And if there were any message that they would have me give to everyone, it would be do that work at the front line, because the cases that are emerging are a direct result of transmission that's occurring in the community. The more that people can follow those stay-at-home directions and absolutely make sure they're not going out if they're unwell, but getting tested and isolating and getting that result will make their job easier.
Is the team still overwhelmed at the moment, though, with the numbers we've got coming through?
They're not overwhelmed. There are a bunch of efficiencies that have been brought in. There is increasing recruitment to that team, and there is increasing linkage of interstate counterparts to support it, including Queensland from today.
On those Alfred Street towers, is there a risk between people exercising out the front and community transmission? Is that why perhaps the fencing was put up in the first place?
I don't know why the fencing was put up. I think it's just a manageable way to make sure that people who are exercising, getting their fresh air, but who are otherwise required to be in quarantine, do it in a confined area.
Have they been allowed to exercise? Lawyers say that they think they haven't been.
I don't know. I'm not involved in the operational element.
Are we aware of how many people within that tower alone that remain in lockdown has the virus or was it close contact?
Yeah, we'll have updated numbers this afternoon.
What do you make of how we're tracking regional areas, and what do you think of do you have plans around that kind of ring around Melbourne? Could you set up testing spots there to kind of guard that regional spread?
Well, there are testing spots right across the state. There are over 150 testing sites, and there are many, many in regional areas. I would encourage regional areas to have an awareness that they also need to test in exactly the same way if they've got compatible symptoms of coronavirus. So we're identifying cases that are in regional areas. Many of them have some link back to Melbourne. That's not unexpected, and we knew that there would be some seeding of regional areas. We need to follow those cases. They will be more manageable by virtue of the numbers, but we are particularly focused on them so that we can make sure that there isn't community transmission that gets established in any regional area of Victoria.
You made it very clear the other day that you're not going to be forcing VCA kids to wear masks at school. There have been some reports of schools that do want to force that to happen. What would you say to them? What should schools be doing?
Look, I'd say that masks are useful. I would make it clear that students who are unwell shouldn't be in the classroom. Students also, we need to empower all of the youth in Victoria. That includes the Year 11, 12 and the Year 10 VCE and VCAT students to follow the stay-at-home directions. We know that they also want to protect themselves and those around them. So they can do the right thing by staying at home. They can do the right thing by making sure they're not going to school when they're unwell. There'll be temperature testing. All of those are other useful mitigations. They'll be encouraged to do all of the right things in terms of hand hygiene, and they are free to wear a mask if they wish to.
Many parents will be pained by the fact that they will be remote learning, flexible learning over the next couple of weeks. How hard was making that decision, giving that advice to the parents?
Yeah, there are really tough decisions every day. I know families will absolutely be paying to have kids at home and needing to juggle all of their responsibilities. My household will have a little bit of pain in that regard because, there are many households where there are professional workers who are trying to work at the same time as those kids are home doing remote learning, and it is a really significant challenge. Some kids thrive, some kids can struggle with remote learning. We have to manage that. We haven't even gotten to a peak with this epidemic, and we have to throw absolutely everything at it. It's the public health challenge of our lifetime, the biggest for 100 years since Spanish flu, and it would have been irresponsible of me to have gone into a phase where we might even have increasing numbers day on day to have kids going back to school, and as we've said, 700,000 plus moving about the state.
Would you just clarify, when you say if we haven't hit the peak, what are you expecting, just for people at home?
I don't know what to expect with this. We have to reinforce that it is in everyone's hands. So there is no magic forecast that I can give, because I don't know if everyone is going to do the right thing. I do know if we do the right thing, we can absolutely turn this around and beat it. We must. And I would expect that if we are doing that and testing appropriately and isolating appropriately and doing all of the things that the key messages have tried to reinforce right through this, then we could see it turn around in the next week. But there is no guarantee there.
A big part of the first lockdown was obviously not just mitigating the spread, but making sure our health system was prepared with beds and ventilators. Where are we at now in terms of those numbers? Because obviously only 15 in the ICU is relatively good. And what is our capacity?
Look, it's not my area. It's still a challenge to have a lot of additional cases in ICU. A lot of emergency departments run pretty tight under normal circumstances, but the number of hospitalised in terms of overall bed capacity and the surge capacity in the system is relatively small. But it becomes challenging when there are hundreds of healthcare workers who are furloughed, who have been close contacts and have to be identified and do 14 days in quarantine. That's an additional strain. But I know that all the hospitals are responding to that appropriately.
Can I ask that same question?
Sure. No worries. Well, Mark, I'd make the point that any system will always struggle if there are thousands and thousands of people who need hospital care, and it is in our hands whether our nurses and doctors, the whole team in our hospitals, will be having to confront thousands and thousands of patients. If we follow the rules, give you a couple of examples. If you are sick and you don't go out, other than to get tested, and then you isolate at home till you get your results, and then if you are positive or you are a close contact of someone who's positive, you do what's being asked of you, and that is to stay at home for the 14 days. It's just a fact there will be less people in hospital. There won't be no one in hospital, but there will be certainly many, many less than would otherwise be the case. If we want to thank the last line of defence, our nurses and doctors, if we want to thank them for the work that they do, then we've all got to follow the rules. That is the most profound way in which we can thank them for their professionalism, their courage, their care, is to do the right thing. All of us are to play our part. In terms of health system preparedness, I think we'll have a little bit more to say later in the week about all sorts of different things that we're doing, different steps that we are taking. Obviously, the time that we've bought, if you like, not getting to that New York style peak, a Spanish peak, those sorts of numbers. I think Brett made the point the other day that the United States is getting our number every 5 or 10 minutes. Our daily number is occurring over there literally minute by minute. Our challenge is very big though. We don't want to get to that point, and that's why we have got some time. We've used that well, whether it be PPE or other equipment or training up additional staff. I think we are very confident that we have sufficient hospital system capacity, but at the end of the day, we want to try and avoid having to use even that expanded hospital resource, and that's in all of our hands. We can all make a really important contribution to our nurses and doctors not being overwhelmed, and that's simply by staying at home, only going out when you need to go out, wearing a mask if you don't think you can maintain that 1.5 metre distance, following the rules and using common sense and good judgment. And again, I thank every Victorian who's doing that, and it's the vast, vast majority. To those who aren't, I just appeal to you. For whatever reason might motivate you, perhaps the notion of thanking our health workers is the thing that will get you to do the right thing. I'm not really fussed about what motivates you to do it. You've just got to do it.
This announcement about remote learning obviously affects government schools. What do you think is going to happen with private independent schools, and have there been discussions?
There has been, just as there was last time, just as there has been right throughout, and I think it is our expectation that both Catholic education and independent schools will follow the same settings that the government has announced today.
And on those
Sure.
tower at Belford Street last night, that fencing that went up, obviously a lot of residents inside were horrified by it. What's your thoughts on that?
Well, I think the truly horrifying thing would be if people were not taken care of, and if we put in place settings that allowed this to spread right throughout the tower. Every single resident in that tower is being treated as a close contact of somebody who has tested positive. It is a unique environment, and the notion of supervised fresh air, the notion of also keeping other people out of that environment, it's a no visitors environment. So there are police there. I understand that some of those scenes are challenging, but it's a challenging circumstance. It's a unique environment, and the only thing that's driving people is not so much how things look, but how we get the job done. That's what's driving everybody, and that's what everybody is completely focused on. And my latest report, and I get multiple updates each day, food service, grocery service, perishable food service is going much better. We've got really substantial teams providing physical care, mental health care. The list goes on and on. It is a unique environment, and the response is unique and absolutely proportionate to the risk. The optics of these things, that's not the concern here. What is of concern and what motivates a big team of people who are doing the very best they can is to take care of those people.
Are you aware of any police incidents in the last 24 hours, any people caught breaking the rules?
No, I'm not. Well, sorry, I should say I'm aware that police may well have an update for you at a later point today, but I don't have any details of individual cases. But there will almost certainly be a number of instances where people have not done the right thing. And again, I just appeal to them. No one has the luxury of being able to do the wrong thing thinking that, oh, well, it'll just affect me. These are my choices. No, they're not, because this thing spreads so widely. It is so wildly infectious that every time someone makes a bad choice, the whole community potentially pays a price for that. That's why there's fines, that's why there's rules, and that's why Victoria Police are not mucking about. But again, I just want to be clear, we are so grateful to the vast majority of Victorians who are doing the right thing, but we've just got to stay the course on this for whatever reason. But I think one of the most important reasons is an opportunity to thank that last line of defence in our fight against this virus, health workers, for their courage, for their care, for their compassion. If you want to say thank you to them, then follow the rules, do the right thing, and there'll be less people in hospital, there'll be less risk for those health workers, and of course there'll be less tragedy for families.
There was a report today of children in state care being issued with $1,652 fines for breaching social distancing. Victoria's fine levels vastly exceed those of any other state. Does that show that police maybe need to be showing a little bit more discretion than they have been in issuing those fines? No,
I think Victoria Police have shown, I'll go back to the fact of the matter, and people can make their own judgments, but the facts are these. Many, many more warnings and cautions were issued than fines were issued the last time, and the Chief Commissioner has been abundantly clear, and I support him in this absolute clarity, that there will always be some grey areas, and it's fair and reasonable for police to exercise good judgment. The notion, though, that people can now flagrantly ignore the rules and behave badly and just get a warning from Victoria Police, I think that would be, you'd be unwise to embark on that strategy. That's not what the Chief Commissioner has said. It's not what his members are going to be doing. Good judgment, fair judgment will always be exercised, and there will always be cases where things are a little more complex than they might seem. But if you're out there just selfishly breaking the rules, Victoria Police, the time for warnings are over. The Victoria Police will take action against you. That gives me no joy, gives them no joy, because it shouldn't be happening. These are choices. It's not too often that somebody, without knowing it, finds themselves in absolute breach of the rules. Don't make those choices. Make a choice that's much better for your family, for your community, for every family, by doing the right thing. That's how you thank our health workers. That's how you limit the spread of the virus. That's how you get out of lockdown quicker than would otherwise be the case.
There was another case, Premier. There was a woman who was doing the right thing. She was on the way to feed her horse and she was fined. Police told her a few hours later to be rescinded. Are you worried that by police perhaps being overzealous, that might send the wrong message to the rest of Victorians? That might
I wouldn't.
Some faith in how it's being
I wouldn't describe police actions in those terms. Police are out there just like the rest of us, doing the very best they can. They take this very seriously, as they should. All Victorians should take this very seriously. I think the Chief Commissioner has dealt with that particular issue. As I said, there will be cases where good judgment, fair judgment needs to be applied to the circumstances of that case. But it's a really clear message. If you're going to break the rules and you think that you'll get away with it because you'll just get a warning, that's not a smart judgment to make. It's also not the right judgment to make, because you're not just putting yourself at risk and your family, you're risking the community and the broader safety of every single Victorian, and you are actually making it more likely that the lockdown is in place for longer. No one wants that. Nobody wants that. We don't want these restrictions to be in place for a moment longer than they need to be. And again, a thank you to the vast majority of people who are doing the right thing, and you can see it. Freeways that are empty, shopping centres that are largely empty, other places of gathering where there are no people. That is exactly what we need to see. As painful as that is, it's what we need to see happen. Regardless of what motivates you, it's just what has to be done over these next 5.5 weeks.
Just back on schools, the Tupper cluster reached 134 yesterday. How much impact did the size of that cluster have on your decision to revert to homeschooling?
I think that it's less about a cluster which is contained and being managed. It's more about that notion of 700,000 students and their mums and dads and carers moving back and forth, going about their business as if this was a normal term 3. It clearly isn't a normal term 3. It's not a normal Sunday. It's not a normal winter. We've got to find a new normal, and I know that's unpleasant, and I know that there'll be many, many parents who will be very upset to hear this news, but it's what must be done, and the job here is to make the tough calls to get us to the other side of this, to see the strategy work. That's what I'm doing, that's what the advice says I have to do, and that's exactly the leadership we offer. We're not about second-guessing the public health advice. And if you think about it, as difficult as it will be for many families, I think most people would accept the logic that if we have a stay-at-home order, but 700,000 kids and their mums and dads are moving around the metropolitan area every morning, every afternoon, that's not consistent with stabilising numbers or driving them down. It's in fact likely to mean numbers continue to go up. That's not what anyone wants.
Premier, as Victorian parents face the prospect of having their kids now at home, it's an exceptionally difficult task. What do you make of the Prime Minister's decision to take some time off to spend time for school holidays with his own children? I was asked similar questions during the summer. I wouldn't begrudge anybody taking time with their family. I don't think that's an unreasonable thing. And I have to say, before you give me the footy question, I got better things to worry about than who went to the footy in New South Wales. Can I ask Minister Merlino just for some clarification? How do we decipher who are children with special needs? How do they go about getting permission to study in school, and how will that process work?
Yeah, we thought about this long and hard. The clear feedback from parents in particular, but also schools, is just how challenging flexible and remote learning at home is if your child has a disability. We wanted to put the settings in as broad as possible. That's why from Monday it's all special schools, and then from the 20th of July it's all students with a disability. So we could have said it's only students who receive PSD funding, which is a funding program for students with a disability, but there are tens of thousands of kids that have additional needs that at the moment don't receive that funding. So we've gone the broadest net possible. It's all students with a disability. Parents will have the option of sending their child to school for on-site learning. They'll be learning flexibly, but they'll be on-site. And as the Premier said, it could be 5 days a week, it could be 2 days a week, it could even be a half a day a week to provide a bit of respite. So we've defined it broadly. It'll be conversation between parents and carers and the school, but to be absolutely clear, this is all students with a disability from the 20th of July, there will be the option to either learn remotely from home or learn at school on site.
So they could choose 5 days, for example. They
Sorry?
could choose to have the whole 5 days at school if they really need that respite.
Absolutely, yeah. So this is a broadening of the settings that we had in place in the previous period of flexible and remote learning. So previously it was vulnerable children and children where parents cannot provide care at home because they've got work commitments. We've added a third category, if you like, and that is for all children with a disability.
And so teachers they'll have these next 5 days as pupil-free days, then will teachers return to working from home, or can they be at school to facilitate at home learning?
So all staff will be at school for this coming week for the 5 pupil-free days, and that'll be a combination of teachers in secondary school providing face-to-face teaching for VCE and VCAT students, but it's also a period where teachers and staff will be preparing for flexible and remote learning. From the 20th of July, the default setting will be staff will be at school, because you will have a number of tasks where teachers and staff will be required to be at school. A number of teachers will be providing face-to-face teaching. So default all staff at school, but each school will have the flexibility to have a number of teachers and staff working remotely. So it's a bit of a flip on what we had in place for the first period of flexible and remote learning.
Dr. Sutton, do you want to ask another question?
No, I was going to ask the Premier a question.
Dr. Sutton, I specifically asked your department last week about infections in the Carlton Towers in Richmond, and were told that there were either none or none that they were aware of. Given that we've got 22 today, and you said you've been monitoring them for more than a week in Carlton, are there any in the Richmond Towers, even if they lived there and have since been transferred elsewhere, so that they don't infect other residents?
I'll get back to you on that. Look, there's an entire operational team who are following up these cases that come in overnight every day. It wouldn't surprise me if there might be some link to Richmond Towers, but I honestly don't know.
Are they from any other towers? You mentioned Victoria, Dandenong or more places?
Yeah, I can update on all of the tower cases. Again, they will reflect the communities in which they sit, where there are cases in those postcodes. So we should not be surprised about the presence of coronavirus cases in any tower. What we need to do is to support the communities in those towers to manage the risk if there are cases there, which is the same for anywhere else, but it needs to work very intensively and cooperatively to make sure that people are supported in their isolation and in their quarantine, and where necessary, the support to have people who need to isolate elsewhere to protect the remainder of that household, or indeed quarantine elsewhere as a close contact to protect others there.
Given the risks in those environments, are you doing more testing further afield in towers in, Collingwood, Richmond and Carlton?
Yeah, we are. We're stepping up testing in a lot of those areas. We're now at a point where no one has to go more than about 10 kilometres for a testing site in Metro Melbourne. So we're certainly ramping up testing. We've got more testing available than anywhere in the country, and people should feel like there's a pretty easy pathway for them to get tested, and shouldn't hold back if they have even the mildest of symptoms.
Was the decision on schools influenced at all by evidence of child-to-child transmission, or you would have made the decision anyway?
Look, I think when we're at a point where we're at 270 plus cases per day, it's the wrong decision to say here's an additional huge cohort of people moving around Metro Melbourne and Mitchell Shire. But child-to-child transmission has become more apparent as we've tested more kids. It's still not a significant risk, but some of the earlier evidence was clearly biased by the fact that kids had mild symptoms and they weren't being tested. We've done much more extensive testing. We've found that there are probably more kids who get infected, not necessarily passing it on and propagating an epidemic or an outbreak, but certainly kids are getting infected when you've got high community levels of transmission.
Should there be masks not in classrooms between VCE teachers and VCE students? Obviously, everyone would want to be at school at this time, and they're also concerned about
Yeah, as I've said, masks will provide some protection, so no one should be prevented from wearing a mask, and that includes going to and from school for kids and for students. And so teachers should also feel free to wear masks on the way to school, going home, or indeed in a social setting in the school. But teaching's pretty tough with the mask on. They require those facial expressions. They require the ability to be understood and heard clearly.
Can I just ask a Premier? Sure.
Are you aware
Yes.
of your timeframe on how long flights will be diverted from Victoria for?
I've made it very clear to the Prime Minister and to my National Cabinet colleagues that that'll be until further notice. I think that I think people would understand and appreciate that while we have this much contact tracing to do, this much testing to do, when we've got this challenge at hand, then that needs to be our exclusive focus to try and drive those numbers down. So that's the setting as it is now. That hopefully can change at a time in the future. But of course, just as we're grateful to other states for providing additional support to us in lots of different ways, and indeed the Commonwealth, we're very grateful for this too.
With the situation we're in, Premier, are you worried about anti-Victorian sentiment developing around the rest of Australia? And I suppose, what's your message to the rest of Australia on behalf of Victoria?
Oh, I'm not about sending messages to the rest of Australia. I'm focused on dealing with what has to be dealt with, doing what has to be done here in Victoria. And that, if I can just take you through a few examples, everyone in Melbourne and Mitchell Shire need to follow those rules. Only be out of your house when you absolutely need to be, and for those 4 permitted reasons. If you're sick, get tested. If you're waiting for a test result, isolate at home. If you're positive or a close contact, you must isolate at home. There's no ifs or buts. You must isolate at home. You must follow the advice that's given to you. If everyone does that, together with, in a broad sense, everyone sticking together, and again, thank you so much to all of those who are doing the right thing. To those who aren't, please moderate your behaviour. Please make better and smarter choices for yourself, for your community, for the entire state. Everyone has a part to play. Let's not leave it to the last line of defence. Our highly skilled, courageous, compassionate nurses and doctors, let's not rely upon the last line of defence. Let's understand that we are all at the front line in our fight against this virus, and let's all of us play our part, large and small. That's how we will defeat this thing. That's how we will get to the other side of this lockdown as quickly as possible.
Premier, Professor Sutton's just explained that this is the public health challenge of our lifetime.
No doubt about that.
Victorian kids can't go to school. I mean, the strain on everybody's face is evident. Do you really have nothing to say about the Prime Minister going to the football? I understand it's uncomfortable, but he's gone to a football game. Kids can't go to school here.
It's not a matter of comfort or discomfort. I'm focused on what I need to be focused on. And I've answered the question, just as I did back during the summer. I'm not going to chip a bloke for spending some time with his family. In terms of who goes to what footy match in other states, I've got much bigger things to worry about than that. I really do. And nothing is gained by me offering gratuitous opinions on things like that. I've got a job to do here. I am absolutely 24/7 focused on it because that's what I have to do. We have got to get beyond this, and the only way we can do that is make good decisions, tough calls, and ask every Victorian to work with me and my team, a team that is thousands of people big. But we can't do it on our own. We need every single Victorian to acknowledge that you are on the front line. Don't leave it to nurses and doctors to be the last line of defence. You're on the front line with me and my family and every family. And we all need to make smart choices for ourselves, for each other. That's the only way we will stabilise these numbers and drive them down. I'm confident. I'm confident because we see it on our freeways, in our shopping centres. People are moderating their behaviour. If I could get the kids back to school, I would. But you just can't have 700,000 kids and their parents moving around the community and pretend that that's in any way compatible with driving these numbers down. It'll drive them up. That's what will happen, and we just can't allow that to happen.
Premier, the Cats and Advisory Group this week, the WA government says it will not allow their families to go with them. Given that they're going to go from Perth, probably going to Sydney, it's likely going to be at least a month if they're not going to have any family contact. Is there anything you first sympathise with them? Is there anything you can do in terms of chatting with the WA government?
Oh, look, I'm happy to follow that up, but I don't think there'll be much that will sway the WA government from the decisions they've made. Everyone's making sacrifices, everyone's having to do things very differently than what they normally would. It's not an ordinary footy season, we can see that. I'm happy to try and take that offline. AFL work very closely with our public health team but I'm not briefed on that matter, but I'm more than happy to get the details from you. Any other issues? Thanks very much, everyone.
We've been hearing there from the Victorian Premier, Daniel Andrews, with an update there. 273 new cases in Victoria. One man aged in his 70s has died overnight also in Victoria.